usually, most of the time in the training course, the doctor says why we don't have a blunt needle, why we don't have a cannula. And the reason is simple, because when we start the experience with atrial suture, we use the cannula, the blunt cannula. And to go out in the exit point in the distal part is really easy. But when you arrive to the temporal area, you have to create the exit point. To find the exit point with the cannula in the temporal area is not so easy, especially with the more tightened skin. And finally we decided that it was much better to have a little risk to be cutting with a cutting tip than the cannula, because to find the exit point, finally you will do more trauma than to go only once going with the cutting tip. So the cannula is the evolution, probably we are speaking about, for the longer suture that we use in the U part, because we are always downwards in the distal part. Thank you.
Okay, I'm going. Roberto?
Yes, please, go ahead. Thank you.
Okay, and as you see, we are in the right position. You help yourself with the cap, and I want to show you take this, take a look, the loop.
Be careful with the hand, thank you. Good, perfect.
You see?
Yeah.
You take this.
You see the loop?
Take this. Okay. Okay. You follow me. Did you see?
Stop a moment.
Yeah.
It's very important to have some thread behind the last cone, because if the cone is very close to the entry point, do not have a space to do the rotation and stuck on the entry point. And the cone is 2.5 millimeters, and the hole is 1 millimeter, 1.2. So can't go in, and this is one of the reasons if you don't check it, you can break a suture if you force the insertion.
Okay. So, and she helped me in order to show very slowly. You have to massage, and remove, and this is the very delicate moment, the last cones. We have to go. And
so you see that now the two threads in one side are inserted, and the timing we take is a normal time that any doctor can have, even if it's beginning for the first time, is not longer. Really is a fast procedure in this part.